welcome to Dental Notes and Mnemonics. Today we'll be discussing bleaching in dentistry. In the earlier video, I just discussed the various management of discolored teeth, and in this video we'll be discussing bleaching in detail. Tooth bleaching or tooth whitening is a common dental procedure which is aimed at enhancing the aesthetic appearance of the teeth. Bleaching is primarily used to treat tooth discoloration as it lightens the teeth that have been stained over the period of time. However, there are two main categories of bleaching technique. First is the vital tooth bleaching and the other is non-vital tooth bleaching. But they both serve different purposes based on the health of the tooth. They both serve different purposes based on the health of the tooth and the underlying cause of the discoloration. First of all, we will talk about vital tooth bleaching. Vital tooth bleaching is indicated for the teeth that have live pulp, meaning the tooth is still healthy and functional. It involves the application of bleaching agents like hydrogen peroxide or carbamide peroxide directly to the surface of the teeth. These techniques can be in-office bleaching or at-home bleaching. In-office bleaching is performed by a dentist in the office. This technique uses stronger bleaching agents along with a light activation to accelerate the whitening process. It is faster method and provides immediate results, making it ideal for the patient seeking a quick solution. An at-home bleaching is a technique which involves the custom-made trays filled with a lower concentration of bleaching agents which patients use at home over a period of time. Although it is less intensive than the in-office bleaching, it provides a more gradual whitening effect. Second category of tooth bleaching is non-vital tooth bleaching, which is necessary for the teeth that have undergone root canal treatment, where the pulp is no longer alive. The procedure involves the bleaching agent is placed inside the tooth, especially in the pulp chamber, to treat the internal discoloration that typically occurs after root canal. Again, this has also two techniques, walking bleach technique or the internal bleaching. In walking bleach technique, a mixture of hydrogen peroxide and sodium perborate is placed inside the tooth. The agent is left in place for a certain period and a patient returns for the periodic changes of bleaching agents until the desired result is achieved. In-office technique for bleaching the non-vital tooth is known as thermocatalytic bleaching also. In this technique, a bleaching agent, usually hydrogen peroxide, is applied to the tooth and a heat source such as special light or heating element is applied to accelerate the chemical reaction of the bleaching agent. Inside out bleaching technique is a specialized method used primarily for whitening discolored teeth that have undergone root canal treatment. This technique combines the internal bleaching for whitening inside the tooth and external bleaching is for whitening the surface of the tooth to achieve an even or a natural looking result. If we compare both vital bleaching and the non-vital bleaching, vital bleaching is ideal for the teeth that are still alive where the external stains or general aging have caused the discoloration. Talk about the indication of tooth bleaching. The tooth bleaching is indicated in case of surface stains which are also known as extrinsic stains, as these are caused by the external factors such as food, drinks like coffee, tea or wine, tobacco use or poor oral hygiene. Bleaching is an ideal solution for extrinsic stains as it helps to remove or lighten these superficial discolorations, leaving the teeth brighter. Intrinsic stains occur within the tooth structure, often due to the factors like aging, certain medications like tetracyclines or trauma to the teeth. Intrinsic stains can be more challenging to remove, but it can still be treated effectively with internal bleaching techniques, particularly for discolored teeth that have undergone root canal treatment. As the individual ages, the outer enamel layer of the teeth naturally wears away, allowing the yellowish dentine beneath to show through. So tooth bleaching helps to restore the brightness and whiteness of the teeth by lightening the dentine color. Bleaching, while effective for many patients, is not suitable for everyone. Certain conditions and the factors may make bleaching treatments unsafe or ineffective. The primary contraindications include the breastfeeding and pregnancy. Bleaching agents like hydrogen peroxide may not be safe for pregnant or breastfeeding women, as the effects on the fetal or infant health are not fully known. Bleaching is generally not recommended for the children under the age of 16 years, as their teeth are still developing, and the procedure can cause tooth sensitivity or damage to the enamel. Patient with extreme tooth sensitivity may find bleaching treatments too painful, especially when using a stronger agents. Teeth with untreated cavities, cracks, or gum diseases should not undergo bleaching, as the chemicals can irritate the pulp and worsen existing dental issues. Also, some patients may be allergic to bleaching agents, which can cause the irritation, swelling, or reaction. So, bleaching procedure is contraindicated in the allergic patients. Go through the various activation of tooth bleaching methods. In case of in-office bleaching system, the activation method is light, such as blue LED or heat, which is commonly used. The purpose is to activate and accelerate the reactivity of hydrogen peroxide, releasing oxygen radicals more quickly, and this speeds up the oxidation process, breaking down the stains faster. Example of this in-office bleaching system is Zoom Whitening and Philips Zoom, where blue LED light enhances the result in under an hour. Second method of activation in case of custom take-home systems is none. They don't have any activation method. These systems function passively, as they use the low concentration peroxide, which works gradually over the time without light or heat. So this method minimizes sensitivity while providing consistent result. The third method of activation is laser or light activated system. These systems utilize laser technology or light sources such as LEDs. The laser or the light heats the hydrogen peroxide gel, accelerating its reactivity, and this enhances the oxidation process, allowing deeper and the faster stain removal. If we talk about the mechanism of action of tooth bleaching agents then the bleaching agents like hydrogen peroxide or carbamide peroxide, they release reactive oxygen species such as free radicals, nascent oxygen, and hydroxyl ions. And these reactive oxygen species with double bonds in chromogen, breaking them into smaller colorless molecules. The procedure reduces the concentration of pigmented compounds, making the tooth appear white. We may classify the bleaching agents on the basis of concentration and the method of application. On the basis of the concentration, there may be the high concentration bleaching agent and the low concentration bleaching agents. High concentration bleaching agents are used in in-office bleaching process, and these agents contain a higher concentration of hydrogen peroxide, which is roughly around 15 to 40%. On the other side, the low concentration bleaching agents are used at home bleaching agent, and they have typical lower concentration of hydrogen peroxide or carbamide peroxide, around 3 to 10% are used. The results are slower, or they take longer to achieve noticeable whitening, often requiring several weeks. On the basis of method of application, we have tray based bleaching agents, where the hydrogen peroxide or carbamide peroxide is an active ingredient in gel form. On the method of application, we have the strips or paint-on gels, which typically has a low concentration of hydrogen peroxide. And on the basis of the mechanism, we may divide the bleaching agents into oxidizing agents and non-oxidizing agents. Oxidizing agents, they work by releasing oxygen molecules that break down the stains into smaller particles, thereby whitening the teeth. On the other hand, non-oxidizing agents such as sodium perborate, they primarily work for non-vital bleaching, such as internal bleaching after the root canal treatment. Procedure step for in-office bleaching or the vital teeth involves the initial consultation, where we assess the patient's dental health, shade of the teeth, and expectations. The teeth are cleaned and polished to remove any other surface plaque or the tartar before the bleaching. The rubber dam or gel is placed to protect the gums from bleaching agents. Hydrogen peroxide or carbamide peroxide is applied to the teeth. Then some procedures uses light or laser to activate the bleaching agents, although the effectiveness of light activation is debated still. The patient is given advice on managing the potential sensitivity and oral hygiene after the procedure. Talk about the limitations of bleaching technique. One of the most common side effects of bleaching treatment is temporary tooth sensitivity. Some patients may experience discomfort during and after the procedure, but that is a temporary phase only. Tooth bleaching is particularly effective for extrinsic stains like those caused by food and drink. However, for the intrinsic stains, they may not respond well to bleaching treatments. Bleaching will not affect crowns, fillings, and veneers, so the patient with extensive restorative work may need to replace these after whitening to match the new tooth shade. The effects of tooth bleaching are not permanent. Over time, teeth may return to the original color, requiring touch-ups to maintain the result. And some individuals may experience mild irritation to the gums from the bleaching agents, but this usually resolves after the treatment. One of the most significant benefit of tooth bleaching is ability to improve the aesthetic appearance of the teeth. And by removing stain and discoloration, bleaching makes the tooth appear whiter and brighter. Unlike the other dental procedures that may require drilling, injections, or removal of tooth structure, tooth bleaching is a non-invasive procedure. It does not require altering the tooth in any way, making it conservative treatment for those who are seeking cosmetic improvement. This is a key advantage over treatment like crown veneers, which can be more involved and costly as well. Another appealing feature of tooth bleaching is the quick results it offers. Especially with in-office bleaching treatments, patient can achieve noticeable whitening in just one session. This immediate outcome is highly satisfying for the individual looking to improve their smile quickly, whether for a special occasion or just general confidence enhancement. Thank you. This was all about bleaching and different techniques. As a dental professional, we should understand the importance of keeping up with the latest techniques and treatments. In this video, we have explored the various tooth bleaching methods, emphasizing their clinical applications, safety protocols, and patient consideration. Always tailor bleaching options to each patient's needs, considering factors like tooth sensitivity and existing dental conditions. I hope this video serves as a useful resource in your practice. If you have any questions or would like to discuss further, feel free to leave a comment. Don't forget to like, share, or subscribe for more videos like this. See you in the next video. Till then, bye bye, take care, have a nice day.